This is a new concept in the modern neurosurgery, and we treat the patients through a small hole in the groin or in the arm, where we put catheter through this one. Just like you do the angioplasty in the heart, we put catheter into the brain and to the spinal cord, and we treat complex problems in the brain and the spinal cord. The biggest advantage is that there is no surgery scars on the head or in the back, and the patient can go home in a very short span of time depending on the presentation of what grade he is in, and then he is only left with a small needle puncture mark in the arm or in the thigh, and that is the biggest advantage and the biggest revolution in neuroscience that has occurred. Pinhole surgery in the brain is used in a variety of conditions. The main condition we treat with pinhole surgery is stroke. The stroke can be either an ischemic stroke or a hemorrhagic stroke. So first we will consider the hemorrhagic stroke. The conditions that cause hemorrhagic stroke are the aneurysms and AV malformations in the brain, which cause catastrophic bleeding in the brain. This condition being treated with the new technique of pinhole surgery, the patient is left with only a hole in the thigh or in the arm, and the recovery is much faster, and the post-operative period of ICU stay is also shorter, and the period of hospital stay also is reduced. Then considering the second part of it, that is the ischemic stroke. Ischemic stroke, previously there was no hope for these patients other than antiplatelets. Now the biggest advantage is that if the patient is brought to the hospital within the time frame, that is now we consider 6 to 8 hours as the golden hours, the earlier the better. So if the patient is brought to the hospital within the time frame, we can actually put a catheter and suck out the clot and can reverse the neurological deficit. That is, a patient coming with a weakness one side of the body after the treatment can regain the strength immediately, which traditionally used to take months after physiotherapy. Another area where the pinhole surgery has brought in revolutionary changes is prevention of stroke. As all of us know, prevention is better than cure. So we can detect patients who are at risk for stroke. That's what we used to detect in a lot of this healthcare campaign and health checkup campaign. We check for the risk of stroke development. So these patients, we put them through checkups where we used to detect whether there is any block in the blood vessels that is going to the brain. So just as we all know, we do angioplasties in the heart, so now we are doing angioplasties in the head also. That is the biggest revolution. So by doing this, we can actually prevent a catastrophic stroke. That is the biggest landmark achievement that has come in the field of neurosciences. Another area where we are having a revolutionary change is in the helping of the surgeon. So when you are planning a complex brain surgery, a big brain tumor we are planning to operate with a lot of blood supply. Previously we used to face a lot of bleeding while we are operating, and we used to transfuse a lot of blood. Now with this catheter technique, we can actually block the blood supply to the tumor before surgery itself. So one day prior to the surgery or on the day of surgery, first we take the patient to the cath lab, put a catheter, and we block all the blood supply to the tumor. And after that, the surgeon can safely operate on these tumors. So this is also a big achievement in achieving a good patient outcome and safety of the patient. Coming to the conditions in the spine, pinhole surgery has brought a lot of changes in the outcome of a lot of disease conditions in the spine, especially AV malformations in the spine. These are abnormal tangle of blood vessels in the spine which bleed or which reduce the blood supply to the spinal cord, and the patient can come with a sudden weakness of the arm or the leg. Previously, there was no effective treatment for this. But with this catheter introduction and treatment, we can actually block these blood vessels by percutaneous technique, and the condition can be cured totally. Another thing that is possible in the spine is the treatment of the disc and the joint problems in the spine, which traditionally used to be treated with open surgery, or as I mentioned earlier, with a minimally invasive surgery. Some of these conditions can now be treated by introduction of a needle. We introduce needle into the disc and do what is called as a percutaneous discectomy. We suck out the free portions of the disc into a needle, and then the pressure in the disc is relieved. Another technique is by dissolving the substance of the disc and reducing the pressure of the disc. We inject through a needle certain substances like enzymes or a specific gas called ozone into the disc, which reduces the size of the disc and reduces the pressure on the nerve. thus relieving the patient of the pain. Another thing is that when the patient presents with problems in the spinal joints and in the hip joints, there will be severe pain in the movement. These joints can be treated by percutaneous needle insertion and injection, and thus the pain can be relieved.